Question 1. A 72-year-old patient with COPD and a history of frequent hospitalizations presents with increased dyspnea, tachypnea, and low oxygen saturation. Which of the following interventions should the nurse implement first? A. Administer a nebulized bronchodilator. B. Start low-flow oxygen therapy and reassess. C. Encourage the patient to perform pursed lip breathing. D. Administer corticosteroids via IV. Answer. B. Start low-flow oxygen therapy and reassess. Rationale. In COPD exacerbation, hypoxemia is the immediate concern, so the nurse should begin by administering low-flow oxygen. Reassessing the patient's response ensures appropriate adjustments. Nebulized bronchodilators and corticosteroids can follow, but oxygen is the priority. Question 2. A patient with asthma is having difficulty managing an acute exacerbation at home. They report using their inhaler frequently without relief. What is the nurse's next step? A. Instruct the patient to double their inhaler dosage. B. Advise the patient to visit the emergency department for a nebulizer treatment. C. Suggest using a short-acting beta agonist every 15 minutes. D. Reassure the patient and recommend rest at home. Answer. B. Advise the patient to visit the emergency department for a nebulizer treatment. Rationale. When an acute asthma attack cannot be controlled with frequent use of an inhaler, the patient should seek medical attention immediately. A nebulizer treatment or corticosteroids in the hospital may be required for severe exacerbations. Question 3. A patient on BiPAP has been receiving high-pressure settings due to increasing respiratory distress. The nurse notes a sudden decrease in oxygen saturation, increased work of breathing, and absence of air sounds over the right lung. What is the most likely cause of these findings? A. Airway obstruction. B. Pneumothorax. C. BiPAP machine malfunction. D. Pulmonary embolism. Answer. B. Pneumothorax. Rationale. A pneumothorax is a common complication in patients on positive pressure ventilation, leading to sudden decreases in oxygen saturation, breath sounds, and increased respiratory effort. Immediate chest X-ray and further intervention are needed. Question 4. In a patient with COPD who is receiving long-term oxygen therapy, which of the following findings would suggest the need for adjustment in the oxygen prescription? A. A decrease in the patient's hemoglobin saturation to 87% during exercise. B. An increase in the patient's respiratory rate to 30 breaths per minute during rest. C. A decrease in the patient's SpO2 levels from 94% to 88% at rest. D. The patient's use of pursed lip breathing with no improvement in dyspnea. Answer. C. A decrease in the patient's SpO2 levels from 94% to 88% at rest. Rationale. A decrease in SpO2 levels below 88% at rest indicates inadequate oxygenation and suggests the need for a reassessment of the oxygen prescription. Hemoglobin saturation during exercise, respiratory rate changes, and pursed lip breathing are not immediate indications for a change in oxygen therapy. Question 5. A patient is receiving mechanical ventilation in the intensive care unit. The nurse notes that the patient's peak inspiratory pressure, PIP, has increased. What is the most likely cause of this increase in pressure? A. Decreased airway resistance. B. Increased lung compliance. C. Airway obstruction or secretions. D. Increased tidal volume. Answer. C. Airway obstruction or secretions. Rationale. An increase in peak inspiratory pressure is most commonly caused by airway resistance, such as from secretions or mucus plugs. Decreased airway resistance and increased compliance would lower the PP, not raise it. Question 6. A 62-year-old patient with pneumonia is receiving antibiotics and oxygen therapy. The nurse observes an increased respiratory rate, use of accessory muscles, and confusion. Which of the following is the most critical intervention? A. Increase the oxygen flow rate. B. Administer a sedative to decrease anxiety. C. Prepare for endotracheal intubation. D. Increase fluid intake to help thin secretions. Answer: C. Prepare for endotracheal intubation. Rationale: increased respiratory rate, use of accessory muscles, and confusion indicate the patient is in respiratory failure. Intubation may be necessary if the patient is unable to maintain oxygenation. Increasing oxygen or administering fluids are supportive measures, but airway management takes priority. Question 7. A patient with tuberculosis (TB) is placed in airborne isolation. Which of the following interventions is essential to prevent transmission of the infection? A. Encourage the patient to wear a surgical mask when leaving the room. B. Instruct visitors to wear an N95 respirator while in the patient's room. C. Place the patient on a ventilator with positive pressure. D. Administer antibiotics before isolation. Answer: B. Instruct visitors to wear an N95 respirator while in the patient's room. Rationale: N95 respirators provide adequate protection from airborne pathogens like TB. Surgical masks are not sufficient to prevent TB transmission. Isolation, not mechanical ventilation, is the key to preventing the spread. Question 8. A patient undergoing mechanical ventilation develops new onset of hypotension, jugular vein distension, and muffled heart sounds. What is the nurse's most likely concern? A. Pneumothorax. B. Pulmonary embolism. C. Cardiogenic shock. D. Cardiac tamponade. Answer: D. Cardiac tamponade. Rationale: muffled heart sounds, hypotension, and jugular vein distension indicate possible cardiac tamponade, a life-threatening condition where fluid accumulates in the pericardial sac, preventing the heart from pumping effectively. Immediate intervention is needed. Question 9. A patient with ARDS is receiving high-frequency oscillatory ventilation, HFV. The nurse notices that the patient's SpO2 is 92%, and the mean airway pressure is 35 centimeters, H2O. What should the nurse do next? A. Decrease the mean airway pressure to improve oxygenation. B. Increase the inspiratory time on the ventilator. C. Continue monitoring as the patient is stable. D. Increase the FiO2 to maintain oxygen saturation. Answer: D. Increase the FiO2 to maintain oxygen saturation. Rationale: in ARDS, maintaining adequate oxygenation is essential. The nurse should increase FiO2 while monitoring for potential complications related to high airway pressures. Decreasing mean airway pressure or increasing inspiratory time may exacerbate lung injury. Question 10. A nurse is caring for a patient who has been extubated following surgery. The patient is experiencing severe respiratory distress, and the nurse notes an increase in work of breathing and tachypnea. What is the nurse's first priority? A. Increase the oxygen flow rate and reassess the patient. B. Administer pain medication to reduce the work of breathing. C. Prepare for reintubation. D. Instruct the patient to use pursed lip breathing. Answer: C. Prepare for reintubation. Rationale: the patient's severe respiratory distress and tachypnea after extubation indicate the need for reintubation. Oxygen therapy and pain management may help, but are secondary to securing the airway. Question 11. A patient receiving oxygen therapy via a nasal cannula begins to complain of a dry mouth and sore throat. What is the nurse's first action? A. Switch the patient to a different oxygen delivery device. B. Increase the flow rate of oxygen. C. Provide mouth care and assess hydration status. D. Encourage the patient to drink water frequently. Answer: C. Provide mouth care and assess hydration status. Rationale: dry mouth and sore throat are common side effects of oxygen therapy, especially when the flow rate is high. Mouth care can help alleviate these symptoms, and hydration status should be assessed to ensure adequate moisture. Question 12. A patient with emphysema is being discharged with home oxygen therapy. What is the most important part of discharge teaching. A. Instruction on how to adjust the oxygen flow rate as needed. B. Information about the proper use of a nebulizer at home. C. The need for regular follow-up visits for lung function testing. D. Education on smoking cessation and avoiding respiratory infections. Answer. D. Education on smoking cessation and avoiding respiratory infections. Rationale. Smoking cessation and avoiding respiratory infections are the most important factors in managing emphysema and preventing exacerbations. While follow-up visits and nebulizer use are important, the primary focus should be on lifestyle modifications. Question 13. A nurse is preparing to administer a nebulized bronchodilator to a patient with asthma. What should the nurse do first? A. Ensure that the patient is in a semi-Fowler's position. B. Ask the patient to cough before administering the medication. C. Assess the patient's breath sounds before the treatment. D. Teach the patient how to use a spacer. Answer. C. Assess the patient's breath sounds before the treatment. Rationale. Assessing breath sounds is essential to determine the severity of the asthma exacerbation and guide the appropriate treatment plan. Positioning, coughing, and teaching about a spacer are all secondary actions. Question 14. A 65-year-old patient with suspected pulmonary embolism is being evaluated. The nurse notes that the patient is experiencing sudden onset of chest pain, tachycardia, and dyspnea. What is the nurse's first priority? A. Administer aspirin to prevent clot formation. B. Administer oxygen to improve oxygenation. C. Prepare the patient for a CT pulmonary angiogram. D. Administer a diuretic to reduce pulmonary edema. Answer. B. Administer oxygen to improve oxygenation. Rationale. Oxygen therapy is the first priority to improve oxygenation and relieve symptoms of hypoxemia. Although further diagnostic testing is needed, immediate management involves ensuring the patient's airway is maintained. Question 15. A patient on a ventilator develops barotrauma. What is the most likely cause of this condition? A. High tidal volumes. B. Inadequate sedation. C. Low inspiratory pressures. D. Inappropriate oxygen settings. Answer. A. High tidal volumes. Rationale. Barotrauma occurs when there is overdistension of the alveoli, commonly caused by high tidal volumes or high pressures during mechanical ventilation. This can lead to lung injury and pneumothorax. Question 16. A nurse is caring for a patient with chronic bronchitis. Which finding would most likely indicate worsening disease? A. Decreased cough and sputum production. B. Increased wheezing and shortness of breath. C. Increased appetite and weight gain. D. Decreased use of oxygen therapy. Answer. B. Increased wheezing and shortness of breath. Rationale. Worsening chronic bronchitis is typically indicated by increased symptoms such as wheezing, shortness of breath, and sputum production. Decreased oxygen use or weight gain would not indicate worsening of the disease. Question 17. A nurse is caring for a patient with ARDS who is on high-frequency oscillatory ventilation, HFV. The nurse notes a sudden drop in blood pressure and cardiac output. What is the most likely cause of these findings? A. Barotrauma due to high pressure. B. Volume overload and pulmonary edema. C. Hypovolemia and decreased venous return. D. Infection and sepsis. Answer. C. Hypovolemia and decreased venous return. Rationale. HFOV can reduce venous return due to high airway pressures, leading to decreased cardiac output and hypotension. This is often caused by hypovolemia or inadequate fluid resuscitation. Question 18. A nurse is caring for a patient with suspected pneumonia. Which of the following diagnostic tests is most critical for confirming the diagnosis? A. Arterial blood gas analysis. B. Chest X-ray. C. Sputum culture. D. Complete blood count. Answer. B. Chest X-ray. Rationale. A chest X-ray is the most critical test for diagnosing pneumonia, as it provides direct visualization of the lungs. Sputum cultures, ABGs, and CBCs can provide additional information, but the X-ray is essential for confirming the diagnosis. Question 19. A patient with ARDS is receiving mechanical ventilation with a tidal volume of 6 milliliters per kg of ideal body weight. The nurse notes an increase in peak inspiratory pressure. What should the nurse do next? A. Increase the tidal volume. B. Decrease the respiratory rate. C. Perform chest physiotherapy. D. Assess for signs of atelectasis or pneumothorax. Answer. D. Assess for signs of atelectasis or pneumothorax. Rationale. An increase in peak inspiratory pressure could indicate complications, such as atelectasis or pneumothorax. Immediate assessment for these issues is critical to adjust ventilator settings appropriately and prevent further complications. Question 20. A nurse is caring for a patient with ARDS who is receiving prone positioning. What is the most significant benefit of this intervention? A. Improved oxygenation by reducing ventral consolidation. B. Increased comfort and reduction in sedation requirements. C. Enhanced clearance of secretions from the lungs. D. Improved venous return and cardiac output. Answer. A. Improved oxygenation by reducing ventral consolidation. Rationale. Prone positioning in ARDS helps improve oxygenation by redistributing pulmonary blood flow and reducing ventral consolidation. While it can have some benefits for secretion clearance and venous return, the primary benefit is improved oxygenation. Question 21. A patient with ARDS is receiving a lung protective ventilation strategy with low tidal volumes. The nurse notices that the plateau pressure is rising. What should the nurse do next? A. Increase the tidal volume to improve oxygenation. B. Decrease the respiratory rate to lower the plateau pressure. C. Assess for signs of pneumothorax or atelectasis. D. Increase the VO2 to increase oxygen saturation. Answer. C. Assess for signs of pneumothorax or atelectasis. Rationale. An increase in plateau pressure may indicate lung overdistension or barotrauma, such as pneumothorax or atelectasis. Immediate assessment is necessary to address these complications before adjusting ventilation settings. Question 22. A nurse is caring for a patient with an acute exacerbation of COPD. The patient is experiencing severe dyspnea and respiratory distress. Which of the following interventions is the priority? A. Administer a short-acting beta agonist via nebulizer. B. Increase oxygen to maintain SpO2 above 90%. C. Provide a corticosteroid IV to reduce inflammation. D. Initiate non-invasive positive pressure ventilation, BiPAP. Answer. D. Initiate non-invasive positive pressure ventilation, BiPAP. Rationale. Non-invasive positive pressure ventilation, BiPAP, is the priority for severe respiratory distress in COPD exacerbations, as it improves ventilation and oxygenation by decreasing work of breathing. Oxygen administration and medications follow once the airway is stabilized. Question 23. A nurse is caring for a patient receiving mechanical ventilation with a tidal volume of 8 milliliters per kg. The patient's plateau pressure is consistently above 30 centimeters H2O. What should the nurse consider next? A. Increase the tidal volume to improve oxygenation. B. Reduce the tidal volume to less than 6 milliliters per kg. C. Increase VO2 to improve oxygen saturation. D. Administer corticosteroids to reduce inflammation. Answer. B. Reduce the tidal volume to less than 6 milliliters per kg. Rationale. A plateau pressure above 30 centimeters H2O indicates potential risk for ventilator-associated lung injury. The nurse should reduce the tidal volume to less than 6 milliliters per kg to comply with lung protective strategies. Question 24. A nurse is caring for a patient with asthma who is having difficulty breathing. The patient's peak expiratory flow rate (PFR) is 50% of the personal best. What should the nurse recommend to the patient next? A. Use the short-acting beta agonist (SABA) inhaler and reassess. B. Increase the dose of inhaled corticosteroids. C. Seek emergency medical attention immediately. D. Use a peak flow meter every hour until the peak expiratory flow increases. Answer. A. Use the short-acting beta agonist (SABA) inhaler and reassess. Rationale. When PFR is less than 50% of the personal best, the patient is in the red zone and should use a SABA inhaler for quick relief. If symptoms persist, further intervention is needed, including emergency medical attention. Question 25. A patient is receiving non-invasive positive pressure ventilation, BiPAP. The nurse notices that the patient is unable to tolerate the mask, and oxygen saturation has decreased. What is the next action the nurse should take? A. Switch to continuous positive airway pressure (CPAP). B. Increase the oxygen flow rate through the BiPAP. C. Reassess the mask fit and ensure adequate seal. D. Prepare the patient for endotracheal intubation. Answer. C. Reassess the mask fit and ensure adequate seal. Rationale. A poor mask fit or inadequate seal can cause discomfort and decrease the effectiveness of BiPAP. Reassessing the fit and ensuring an adequate seal should be done first. Intubation may be necessary later if BiPAP fails. Question 26. A nurse is caring for a patient with a tracheostomy who is receiving mechanical ventilation. Which of the following is the priority action to reduce the risk of infection? A. Use sterile technique when performing tracheostomy care. B. Change the tracheostomy tube every 24 hours. C. Suction the tracheostomy tube every hour. D. Place the patient on oral antibiotics. Answer. A. Use sterile technique when performing tracheostomy care. Rationale. The priority action to prevent infection is using sterile technique during tracheostomy care to prevent introducing pathogens into the airway. Suctioning and tube changes are important, but come after infection prevention. Question 27. A patient with ARDS is being mechanically ventilated with a high PEEP setting. The nurse notes a sudden decrease in cardiac output and hypotension. What is the most likely cause? A. Decreased venous return due to increased intrathoracic pressure. B. Increased risk of barotrauma and pneumothorax. C. Increased blood pressure from excessive sedation. D. Elevated oxygen levels causing vasodilation. Answer. A. Decreased venous return due to increased intrathoracic pressure. Rationale. High levels of positive end expiratory pressure (PEEP) can increase intrathoracic pressure, decreasing venous return and cardiac output. This is a common complication when managing patients with ARDS. Question 28. A nurse is caring for a patient who has recently undergone extubation. The patient is restless, has increased work of breathing, and is unable to maintain adequate oxygen saturation. What is the nurse's first action? A. Re-intubate the patient and secure the airway. B. Increase the oxygen flow rate to maximum levels. C. Administer a sedative to decrease anxiety. D. Position the patient in a semi-Fowler's position. Answer. A. Re-intubate the patient and secure the airway. Rationale. Immediate reintubation is required when the patient cannot maintain adequate oxygenation after extubation. Sedation, positioning, and increased oxygen flow may help, but are secondary to ensuring the airway is secured. Question 29. A patient with chronic bronchitis has developed signs of acute respiratory failure. The nurse notices the patient's respiratory rate is 40 breaths per minute and shallow. Which of the following actions should the nurse take first? A. Provide non-invasive positive pressure ventilation. B. Administer a bronchodilator. C. Increase the oxygen flow rate. D. Prepare the patient for intubation. Answer: A. Provide non-invasive positive pressure ventilation. Rationale: non-invasive positive pressure ventilation, for example BiPAP, is the first line for acute respiratory failure in chronic bronchitis. It helps improve ventilation and oxygenation. Intubation may be necessary later if the patient does not improve. Question 30. A patient with pneumonia has been started on antibiotics. The nurse observes that the patient's respiratory rate is increasing, and the patient is becoming more confused. What is the nurse's priority intervention? A. Increase the oxygen flow rate to 4 liters per minute. B. Administer IV fluids to prevent dehydration. C. Notify the healthcare provider for further evaluation. D. Perform a sputum culture to assess for resistance. Answer: C. Notify the healthcare provider for further evaluation. Rationale: increased respiratory rate and confusion indicate potential deterioration, possibly due to hypoxemia or sepsis. The healthcare provider should be notified immediately to reassess the treatment plan. Question 31. A patient with a history of pulmonary embolism is admitted with sudden onset chest pain and shortness of breath. Which diagnostic test is the most important to confirm the diagnosis? A. Electrocardiogram ECG. B. D-dimer test. C. Chest CT angiography. D. Arterial blood gas analysis. Answer: C. Chest CT angiography. Rationale: chest CT angiography is the gold standard for diagnosing pulmonary embolism. While D-dimer levels may be elevated, a CT scan is needed for confirmation. ECG and ABGs provide supportive information, but are not definitive for PE. Question 32. A nurse is caring for a patient on a ventilator. The ventilator alarms for high pressure, and the patient is experiencing increased work of breathing. What is the nurse's first action? A. Increase the tidal volume to improve ventilation. B. Check for patient ventilator disconnection. C. Assess for obstruction or secretions in the airway. D. Increase the VO2 to improve oxygenation. Answer: C. Assess for obstruction or secretions in the airway. Rationale: increased pressure on the ventilator is often caused by airway obstruction or secretions. The nurse should assess for these issues first to prevent further complications. Question 33. A patient with acute respiratory distress syndrome (ARDS) is on mechanical ventilation with PEEP set at 10 centimeters H2O. What is the most significant risk of high PEEP levels in ARDS? A. Barotrauma and pneumothorax. B. Pulmonary vasoconstriction. C. Decreased cardiac output. D. Increased risk of nosocomial infections. Answer: C. Decreased cardiac output. Rationale: high PEEP can increase intrathoracic pressure, reducing venous return and leading to decreased cardiac output, a significant concern in ARDS management. Barotrauma, pulmonary vasoconstriction, and infection are also risks, but are secondary to the impact on circulation. Question 34. A nurse is caring for a patient who is experiencing respiratory acidosis. What is the most likely cause of this condition? A. Hyperventilation. B. Pulmonary embolism. C. Severe asthma exacerbation. D. Hypoxia due to heart failure. Answer: C. Severe asthma exacerbation. Rationale: respiratory acidosis occurs when there is insufficient ventilation to expel CO2, often due to severe asthma exacerbations or obstructive lung diseases. Hyperventilation and pulmonary embolism typically lead to respiratory alkalosis. Question 35. A patient with tuberculosis (TB) is placed on airborne isolation. What is the most important aspect of patient care to prevent transmission of TB to others? A. Ensure the patient wears a mask when leaving the room. B. Instruct visitors to wear a surgical mask. C. Place the patient on continuous positive pressure ventilation. D. Ensure proper ventilation in the room and restrict visitors. Answer: D. Ensure proper ventilation in the room and restrict visitors. Rationale: proper ventilation is critical to reducing airborne transmission of TB. Restricting visitors and ensuring the patient wears a mask when leaving the room are also important, but ventilation and isolation are paramount. Question 36. A nurse is educating a patient with emphysema on how to manage their condition at home. Which statement indicates a need for further teaching? A. I should avoid people who have respiratory infections. B. I should rest frequently to conserve energy. C. I can quit using oxygen if I feel okay. D. I should engage in pulmonary rehabilitation exercises regularly. Answer: C. I can quit using oxygen if I feel okay. Rationale: patients with emphysema require continuous oxygen therapy as prescribed. Stopping oxygen therapy when feeling better can lead to worsening hypoxia and complications. Other statements reflect appropriate self-care strategies. Question 37. A patient with pneumonia is receiving antibiotics. What is the priority action for the nurse to ensure effective treatment? A. Monitor the patient's temperature and white blood cell count. B. Encourage the patient to cough and deep breathe. C. Assess for signs of fluid overload. D. Verify the antibiotic prescription and administration. Answer: D. Verify the antibiotic prescription and administration. Rationale: ensuring the correct antibiotic is being administered at the correct dose is the priority action. Monitoring temperature, encouraging coughing, and assessing for fluid overload are important but secondary actions. Question 38. A nurse is caring for a patient receiving mechanical ventilation. What is the most important factor in preventing ventilator-associated pneumonia, VAP? A. Changing the ventilator circuit every 24 hours. B. Maintaining the head of the bed elevated at 30 to 45 degrees. C. Administering prophylactic antibiotics. D. Using a non-rebreather mask instead of a ventilator. Answer: B. Maintaining the head of the bed elevated at 30 to 45 degrees. Rationale: elevating the head of the bed reduces the risk of aspiration, a primary factor in the development of VAP. Changing the ventilator circuit and antibiotics are important, but less effective than maintaining proper positioning. Question 39. A patient with COPD is prescribed long-term oxygen therapy. The nurse notes that the patient is using the oxygen at home, but their SpO2 is still low. What should the nurse recommend? A. Increase the flow rate of oxygen. B. Switch to a high-flow oxygen delivery system. C. Ensure the patient is using the prescribed oxygen during physical activity. D. Decrease the oxygen flow to avoid CO2 retention. Answer: C. Ensure the patient is using the prescribed oxygen during physical activity. Rationale: long-term oxygen therapy should be used consistently, including during physical activity, to maintain adequate oxygenation. Increasing the flow rate without reassessment may not be appropriate and can lead to CO2 retention in COPD patients. Question 40. A patient with asthma is receiving corticosteroid therapy. What is the most important aspect of patient education regarding this medication? A. Take the medication only when you have asthma symptoms. B. Rinse your mouth after using the inhaler to prevent oral thrush. C. Increase the dosage if you feel an asthma attack coming on. D. It is okay to stop taking the medication when you feel better. Answer: B. Rinse your mouth after using the inhaler to prevent oral thrush. Rationale: corticosteroid inhalers can cause oral thrush, so rinsing the mouth after use is essential. The medication should be taken as prescribed, not based on symptoms, and cannot be stopped abruptly. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.